Next up, the Trump White House, according to one report we're getting, is going to tackle your health bill in a major way in the first 100 days. We got new news for you and the plans for Medicare. Georgia Republican Tom Price is being floated as a possible Health and Human Services Secretary. Again, we don't know for sure. He's saying he expects Republicans in the House to move on Medicare reforms within the early months of the Trump administration. And this is why you want to know about this. $669 billion, according to my next guest, spent on Medicare this year. The government blew, they wasted a big $137 billion in wrongful payments from things like Medicare, Medicaid, Social Security. It's according to the GAO. That's the size of Bulgaria. So can the president-elect stop this taxpayer abuse? We've got former Lieutenant Governor of New York and Trump economic advisor, Betsy McCaughey. Good to be with you.
Thank you. And the answer is yes. No one is better prepared than President-elect Donald Trump to stop the fraud and abuse and tame the federal bureaucracy.
How?
Well, he's run 185 profit-making businesses. Well, I'm going to tell you.
Yeah.
Just think about it. He won the election spending a quarter as much and with half as much staff as Hillary Clinton. So this is a man who knows how to get his money's worth. And he's going to take that skill as president to tame this bureaucracy, which is 3 million strong. The biggest obstacle any president has to accomplishing things is to get that giant federal bureaucracy working for the taxpayers rather than just perpetuating.
You're talking about 3 million overall.
Overall, right. So he, in terms of eliminating fraud, waste, and abuse, which he's talked about a lot on his campaign, he's got the skills to put people in each job who actually demand performance from the people in the civil service. But going beyond that, he also is going to work with Congress, and that's what you were really referring to a moment ago, to repeal this giant Obamacare, and that will eliminate parts of Medicare that nobody wants.
Like what?
Well, let me give you an example. This law, Obamacare, took $716 billion, a lot of money, out of Medicare and moved it over to fund a new entitlement. It was like robbing grandma to spread the wealth. And to do that, to take off $716 billion, right, a lot of money over 10 years, and to do that, they included in here some very pernicious provisions. One is called IPAB, which is a board of 15 unelected bureaucrats who can literally, they have the power without Congress to change Medicare benefits. That has to go. Americans don't believe in that kind of dictatorial government, especially on something they value as much as their benefits. Secondly, there's a provision in here, Section 3000, that awards bonus points to the hospitals that spend the least per senior. That incentivizes stingy care, and now we found that about 231 hospitals have been getting these bonus points even though they provide bad care. Such bad
People
care.
Getting
sicker, seniors with heart attacks were forced to wait so long for angioplasties that some of them died waiting in line. So we're going to get rid of that as well. When you repeal Obamacare, you repeal the terrible things that Obama did to Medicare to fund this new entitlement. And then President-elect Trump will work with Congress to modernize Medicare. But the key is, first of all, to stop the things that have been done to take care away from seniors.
Did you save money on your gym to carrying that around? I mean, you get really fit. It's like a cinder block.
Right. So when you hear the Democrats demagoguing, don't touch Medicare, if Democrats want to see the real danger to Medicare, they have to look in the mirror, because what they've done to Medicare has to be undone.
Wow. Betsy McCaughey, we're so glad you're on the story. Thank you so much.